and welcome to the program that gives you first-hand info on health matters. I am Rakiya, Mahmud, Auwal. As we mark the International Women's Day, today our focus will be on issues concerning the women. First on our lineup, we have in the studio a member of the Nigerian Urban Reproductive Health Initiative, NURHI, who will be talking to us on family planning. Still on the program, we have a report on maternal mortality. And of course, we have a doctor who will highlight us more on maternal mortality in our country, Nigeria. The program promises to be very, very enlightening and educating. Stay tuned, we will be right back. You're welcome back. As we celebrate the International Women's Day for their economic, political, and social achievements, and as you are aware that every single living being was born through a woman, and for her to be healthy and have healthy children that can be catered for, it is important that the family is being planned for. And we have in the studio a member of the Nigerian Urban Reproductive Health Initiative, NURHI, and they have their slogan as "Plan your family and get it together." We have in person of Sola, Oladimeji, who will be talking to us on family planning. Ma, you're welcome to the program, Your Health.
It's a pleasure.
Thank you. So now, what is the correlation between International Women's Day, as it's been marked, and family planning?
Family planning is planning your family, spacing of child, getting pregnant at choice, not by chance or mistake. When you plan your family, you get it together, as we have said, under NURHI, Nigerian Reproductive Health Initiative, and NGO, collaborating with the FCT, administration on family planning. And then you've planned your family, you'll be more healthier, not getting pregnant every year. When you get pregnant every year, it tells on the woman. It tells on the woman's health, tells on the husband himself, the economy of the nation, even as a whole. When you get children you cannot cater for, you cannot send them to good school, they cannot go to good, the woman cannot go to good antenatal, the baby cannot be taken to good hospital, and the baby cannot be trained well on an academic. That is going to affect the nation economic as a whole. So a woman, you empower a woman, you empower the whole nation. You empower a woman, you empower the family. You empower a woman, you'll be at rest at home, the head of the family. So it's very, very important. Family planning relates with a Woman International Day, because a woman is the one that is at the forefront at home. Even if the husband is to bring the financial aspect, the woman is there to support the family, to make the family to stand. The woman will even cater for herself, at the same time cater for the husband. And when a woman gets pregnant every year, she herself will be weighed down morally, financially, health-wise. She will not be adequate to take up her responsibility at home. So it's very important for the woman to plan the family. It's important for the woman to space her children. How do you space the children? Is by attending the family planning clinic. You go to the family planning clinic, a provider is there to counsel you, to give you the important thing, to show you how the benefits of family planning.
All right now. So now the theme for this year is aspiring change, equality for women is equality for all. So now let us look at family planning as equality for change.
When we say equality for change, we thank God for our mommy, the first lady of the nation, doctor, patient, Dame Jonathan. She has helped the women at least and is it 35%? And this time around, we are aspiring for 50%. 50%, that is the equality we want now in every aspect of governance, of government in the nation. How do we get that? You cannot get a woman who gets pregnant every year to go and represent you. Our First Lady needs people who are agile to go and represent. We are not saying that women should not put to bed, women should not have their babies to make their family. Women should make their family. But you make it, you plan your family, and the nation at large will be very comfortable. When you when you deliver and you space for about 2 to 3 years, you can serve the nation, serve yourself, and serve the family.
So most women have their reservation for family planning. Can you throw more light on that?
Family planning is very, very simple. I want us to know this, at least our logo. We have this logo of blue, yellow, and red. The blue stands for knowing the family planning, while the yellow stands for talking it together with your partner. Talking it together with your partner. While the orange stands for going for it, which means you know it,
okay,
you talk it together, you go for it.
Okay.
Wherever you see this logo, it stands that is where you should enter.
Okay.
That is where you should go. Okay. And when you go there, there's someone there. Family planning, you don't pay any money. Okay. Every woman should know in FCT, family planning, you don't pay anything. You go there, when you get there, a provider is there and we tell you all the methods.
All right.
All the methods of family planning.
And they are all safe?
They are all very safe. Yeah, when we say counseling, you will talk it together one-on-one, okay, with the provider. Right. And whatever is your myths and misconception that you have had that don't want you to go for it.
So it
in
can
the
be
local
clear.
language, we say that you have heard about family planning. The provider will clear the issue for you, okay, and then you go for the choice you have been cancelled on, okay, the choice you have made.
All right. So now, how can we get the men folks to involve fully in assisting their wife or supporting their wives to go for family planning?
The men,
yes,
they are our supporter at home in everything we do. That is why the slogan says, when you know it, either in the antenatal clinic or wherever, you get home, you talk it with your partner. Talking it together with your partner. Your partner, who is the husband, is now to support you, to agree with you, and encourage you to go for it. The men in this aspect, once the woman have made her choice in the clinic, she now comes home, my darling, I've made this choice. It's left for the husband now to accept the method choose, and then they jolly together.
All right. So now, can you tell us how can it inspire women